Hi guys, I'm Brittany Tibbetts and I'm a registered dental hygienist and I've partnered with Delta Dental. I think this is the fourth video in our series just to bring some information and awareness to you guys about oral health and how it's important for your total body health. I got into dental hygiene because I really love science, and I really love helping people. And so this seemed like a really good fit for me. And then I also really like how your mouth, the health of your mouth is completely intertwined with the health of your whole body. So it's really interesting to take a look at some of these different common conditions that we see in the mouth and how they play on different diseases and chronic conditions that we see. So when you guys go to the dentist, it's not just about getting your teeth cleaned or your cavities filled, things like that. The most important thing that you're there for is for your dentist to do an oral exam. So when dentists do an oral exam, or hygienists, when we take a look inside your mouth, we can actually identify over 120 conditions, diseases, things in the mouth, or even outside of the mouth too. So we also take a look at your head and neck and examine those areas really closely for signs of diseases or oral cancers, things like that. So it's really important to go for your checkups and cleanings and make sure you stay on top of that stuff. You don't ever want to let the poor, if you have poor mouth health, affect the rest of your body. So I wanted to just talk a little bit about some of the different conditions, medical conditions that we see really most commonly with patients. And the first one that I want to talk about is diabetes. So I think it's some crazy number. I think there's over like 9 million people in the United States alone that have either type 1 or type 2 diabetes. So that's a huge number. So we see a lot of patients in and out of our clinics every single day with diabetes. And diabetes has several implications in the oral cavity. So one of the major things that we see is dry mouth. So we've talked in some of our previous videos about how detrimental dry mouth can be to your oral cavity. So when you don't produce enough saliva or you don't have enough saliva washing away a lot of that food debris and bacteria in your mouth, you are much more susceptible to gum disease, cavities, just gingival inflammation, sometimes referred to as gingivitis. So it's really important to manage your diabetes and get some tips from your dentist or hygienist on what to do if you do have some of these symptoms. Something else that we see with diabetes too is delayed wound healing. So lesions in the mouth, infections in your gums, things like that. Often we see delayed wound healing with patients with diabetes, so it's really important to stay on top of your oral care at home and to visit your dentist or dental hygienist regularly so they can give you some tips and how to help you with things like that. Another thing that we see is an increase in infections in the mouth. We also see kids with diabetes, their teeth might erupt at an earlier age than what's typical. So just a lot of different things. It's interesting to know how diabetes can affect your oral cavity. Let's see. One of the other things that I wanted to go over is heart health. So when we have a lot of buildup of bacteria in our mouths, some of that bacteria can actually enter your bloodstream and circulate throughout your entire body. So that can affect your heart. We see that patients with periodontal disease are twice as likely to develop heart attacks than those without. So it's really, really, really important I feel like I sound like a broken record, but to go to your dentist, go regularly for your cleanings and checkups, and to just really step up your home care. Make sure that you're taking really good care of your teeth at home because it is a two-way street. You come in and see us usually right around twice a year, but what you do at home is more important than what we do in the office. The other thing that I wanted to talk about is your brain, actually. So again, as that harmful bacteria builds up in your mouth and underneath your gums, it puts you at a higher risk for developing blood clots. And blood clots, obviously your mouth is part of your head, and so those blood clots can actually get to your brain and make you more susceptible to stroke too. So these are just a couple of different body systems and how they work with your mouth, but you can just see how important your oral health is to your overall health. And then for ladies, the last thing that I wanted to talk about is menopause and how low estrogen levels can cause weak and brittle bones. So your teeth are obviously embedded in your jawbone. So if you have weak or brittle bones and it affects your jaw, you can see how that would affect your teeth. So we see tooth loss and gum disease. Those are really common in patients undergoing menopause. I just want to kind of keep this video fairly short, so I didn't want to dive into a whole bunch of like the science behind everything, but I do really quick just want to give you guys some information on what a thorough oral cancer screening should look like when you go to the dentist. So when you go to the dentist, it's really important that either your dentist or your dental hygienist does a really thorough extraoral, meaning all of the surfaces outside your mouth, and intraoral, surfaces inside your mouth, exam. So you want to make sure that your dentist or dental hygienist palpates or feels a lot of different areas, including the back of your neck, underneath your jawbone. You want them to check your thyroid and your swallowing. And basically what they're looking for are swollen lymph nodes or just anything that feels out of the ordinary. So we'll kind of let you know if we do feel anything that doesn't feel quite right. The dentist will let you know if it's something that you need to have checked into further or if it's something that we can just kind of monitor. But you want to also make sure that they're feeling inside your mouth too. So you want to make sure that they're feeling the inside surface of your cheeks, both sides, your tongue, the top surface of your tongue, underneath your tongue, all the way back on the lateral sides of your tongue. You also want to make sure that you are allowing them to feel your lips. Make sure that they don't feel any little lumps or bumps or anything there. Again, they'll let you know if they do feel anything and just kind of what to do if anything unusual arises. But make sure that you are asking for that if they're not already doing that when you go for your exams. It's really important to make sure that all of these surfaces are checked every time to make sure that things aren't missed between visits. But that's kind of it. I just wanted to keep today's video pretty short. I know we've got a fun topic next week about sugar, and so I feel like that one will be, maybe we can do some different demonstrations. I think we did an experiment last week in our video, so maybe we'll try to incorporate some more of that stuff into next week's video. I think that was a lot of fun for you guys to watch. But tune in, make sure you watch us next week. We're doing this every Wednesday at noon. And again, our topic next week is going to be sugar. And so if you guys have any questions or anything, please feel free to leave a comment or reach out to Delta Dental or your dentist or dental hygienist. Make sure you schedule those exams, checkups, cleanings once offices are open again for elective treatments and checkups. And we hope to see you again next week. And happy brushing!